Hello, I'm Dr. Mitra Motamedi. I'm a family physician practicing in Vancouver, focusing on mental health and ADHD. I already talked about the two main classes of medications, stimulants and non-stimulants, why they are called stimulants, and how they work. I also mentioned that stimulants are considered the first-line treatment and are generally more effective. Today, I'm going to dive deeper into ADHD medications, how we decide which one to start with, common side effects, and address some frequently asked questions. Stimulants are divided into two main groups: amphetamines like Vyvanse and Adderall, and methylphenidates such as Concerta, Bifentin, Foquest, and Quilivant. About 1/3 of people respond better to amphetamines, another 1/3 to methylphenidates, and the remaining group may respond equally well to both. This is why some trial and adjustments are often needed. Stimulants come in both short-acting and long-acting forms. In most cases, we don't use short-acting ones anymore because their effect wears off too quick after a few hours, where symptoms return suddenly and may feel even worse. Because of this, multiple doses per day are needed, leading to ups and downs in effectiveness throughout the day. Short-acting stimulants have a higher risk of side effects like irritability or mood swings. They are also coming with a higher potential for misuse and abuse compared to long-acting ones. I will talk about the topic of misuse and abuse another time. We do prescribe short-acting stimulants in specific situations where they are appropriate and beneficial. Non-stimulants are considered second-line treatment. For those who cannot tolerate stimulants or prefer a non-stimulant option, we have two main non-stimulant medications. One is atomoxetine or Strattera, which is a selective norepinephrine reuptake inhibitor, SNRI. Although it belongs to the SNRI class, it's not used as an antidepressant because it doesn't affect serotonin. Its action is limited to norepinephrine only, with no significant impact on dopamine. This is why it's less effective than stimulants in treating ADHD. It is FDA approved only for ADHD treatment and can be a good option for those who cannot take stimulants. Another non-stimulant medication is guanfacine or Intuniv, which has specific indications. It works by affecting the prefrontal cortex, helping to improve attention, emotional regulation, and the positional behaviors. While it can be beneficial for certain individuals, its use is more limited compared to stimulants. We also have medications that sometimes help and are considered third line for treatment of ADHD. One example is bupropion or Wellbutrin. It affects both norepinephrine and dopamine, with an indirect effect on serotonin. It's primarily classified as an antidepressant. It has additional benefit though. I have found it to be a great option to be combined with the stimulants or be used alone sometimes for individuals who need an extra boost in motivation, energy, and mood. Additionally, it can help reduce appetite for weight management and also as a smoking cessation aid for those looking to quit nicotine. Now, the question is, when do we use non-stimulants? There are several situations where we might choose a non-stimulant medication. When stimulants are contraindicated, like untreated ischemic heart disease, severe atherosclerosis, or uncontrolled high blood pressure, or seizures or glaucoma. Another situation is active substance use when they are not ready to quit. Once these conditions are well managed and under control, stimulants may become an option. Number 2 is when someone cannot tolerate stimulants at all, like some autistic people or those who are highly sensitive. And another group of people are those who need a booster to the stimulants. If someone can only partially tolerate the stimulants or metabolizes stimulants too quickly and needs multiple doses per day, adding a non-stimulant can help extend symptom control. For those who are probably autistic and plus ADHD and anxiety disorder, I sometimes start with atomoxetine strattera instead of stimulants. And if there are behavioral issues like uncontrolled anger issues, guanfacine intunif may be a good addition. How do we choose the right ADHD medication? That's another frequently asked question. There is no strict rule on which one to start with. Every individual responds differently, so we often need to adjust based on tolerance, effectiveness, and side effects. If someone doesn't respond well to one stimulant class or experiences unmanageable side effects, we switch to other class to find a better fit. However, there are some factors that we consider when deciding on which one to start first. For children, for older adults, and individuals who may be more sensitive to medications, such as autistic individuals or those with coexisting anxiety, it is suggested to go with the methylphenidates first, like Concerta or Bifentin or Foquest, as they may be better tolerated in these groups. In my experience, I haven't found a significant difference in tolerance between these two stimulant classes, but individual responses can vary. Another group of people that I consider when I'm starting treatment are those with binge eating disorder, binge eating problems, which can lead to obesity and therefore other problems like diabetes, heart disease, sleep apnea, high blood pressure, and etc. This is linked to dopamine dysregulation that contributes to impulse control difficulties. In these cases, amphetamine-based medications like Vyvanse, there are studies that support Vyvanse to be effective. They tend to be more effective because they increase dopamine release more strongly than methylphenidates, and it can help improve impulse control better in this group. Another factor to consider is affordability. Cost is an important factor when selecting a medication. I learned this from Dr. Diane McIntosh, that in psychiatry at least, brand name medications are preferred because they tend to have stricter regulations and higher quality control compared to generics. There are some assistance programs and discount cards that can help cover the difference between generic and brand name medications, but some higher cost options may still only be affordable for those who have extended health benefits. For those who don't have this insurance coverage, some generic options are still effective. ADHD treatment is not one size fits all. Regardless of which medication we start with, we need to have follow-up visits to monitor the side effects, the effectiveness, and to make adjustments when needed. Finding the right medication and the right dose often takes some time. What are the side effects? This is a question that I'm always asked. When considering stimulant medications for ADHD, it's essential to be aware of potential side effects. Here I talk about some common side effects. Number 1 is decreased appetite. This is one of the most common reported side effects. To help manage it, even for people who suffer from binge eating and obesity, we recommend having a nutritious, protein-rich breakfast and setting reminders for meals and snacks throughout the day. Number 2 side effect is dry mouth. Drinking more water and using mouth moisturizing products or sugar-free gums may help. If it becomes persistent and difficult to tolerate, switching to another medication may be necessary. Another side effect is headaches. Some individuals may experience headaches more during the first days of treatment. These typically resolve as the body adjusts. Staying hydrated and using over-the-counter pain medications can help. Another side effect, which is important, is increased heart rate and blood pressure. The stimulant medications can cause mild increases in blood pressure. In most cases, this increase is small, but in older adults and people with risk factors such as obesity or diabetes, it requires more attention. I have seen anxiety alone may increase the blood pressure. The most common reason for persistent increased heart rate and physical symptoms of anxiety, I'm not talking about worries, I'm talking about physical symptoms like shaking, feeling high or jittery, that's caffeine intake. In most cases, reducing or eliminating caffeine helps normalize both heart rate and blood pressure. It's normal for heart rate to take a bit longer to return to baseline after exercise while on stimulants. I have never had dangerously high blood pressure due to stimulant use. Only a few cases required blood pressure treatment or switch to another medication. Regular blood pressure monitoring is still recommended, even for younger people, to ensure safety. Sleep difficulties is another concern. Insomnia and ADHD is a complex topic that I will discuss in my another video. Many people with ADHD already struggle with falling asleep due to their racing thoughts, and when stimulant medications are optimized and dosed properly, they can actually improve their sleep. However, stimulants may negatively affect sleep too, especially if the medication is taken too late in the day or the dose is too low and wears off too quick and causing a rebound effect, meaning symptoms coming back worse, or when the effect lasts too long in slow metabolizer people. Adjusting the dose, timing, and type of the medication, along with practicing good sleep hygiene and meditation, can help manage these effects and improve sleep. One more concern is growth delay in children. Some research suggests that prolonged stimulant use may lead to a slight reduction in growth rate in children, typically around 1 to 2 centimeters or less than 1 inch over several years. In children, regular monitoring of height and weight is recommended. If concerns arise, we may need to adjust the dosage or consider other medications. It's important to weigh the potential for a mild growth delay against the risks of untreated ADHD, which include academic struggles, social challenges, increased anxiety and depression, and long-term functional impairments. In most cases, the benefits of treatment far outweigh the minimal impact on growth. Raynaud's phenomenon is another rare side effect. I have had few cases reported discoloration of fingers and toes in response to cold weather during the winter time. In most cases, keeping extremities warm helps. However, if needed, a temporary low dose of a medication called amlodipine may be considered to improve blood circulation. Now, if you experience agitation, inner restlessness, or extreme discomfort, like you don't feel comfortable in your own skin, or if you notice a sudden increase in talking or excessive energy, this is not what we expect to see in response to treatment. Similarly, if you feel more anxious, if you feel anxiety is getting worse, I'm talking about worry thoughts, fears, not just physical symptoms. It's important to stop the medication and consult with your doctor. These symptoms may indicate another underlying coexisting condition, such as bipolar disorder or anxiety disorder, which may need to be addressed first before continuing ADHD treatment. While side effects are possible, they can often be managed through dose adjustments, timings, and switching medications. Medications are effective only for the day you take it. I'm talking about the stimulants. You can always stop the stimulants if you feel uncomfortable. Again, it's important to have regular follow-ups to monitor these effects and find the best approach for each person. One of the most common questions I get is, do I need to take my ADHD medication every day? Well, daily treatment is generally recommended, and it works best if you take it regularly and create a routine for yourself. However, in my opinion, I see ADHD as a spectrum, and your need changes over time. So I see it flexible, depending on your needs. At the end of the day, you are in control. If you can manage your life without medication on certain days, like when you're relaxing at home watching TV, it's okay to skip those days. But if you may get distracted while driving and get into a car accident, or if you can't be present when you are with your friends, or your emotions would be out of control, then I would definitely recommend everyday use. By the way, if you are on a non-stimulant, that is different. They need to be taken every day. Some people prefer to take a bit higher dose on busy weekdays when they are working and a lower dose on weekends, and to me that's okay too. Just be mindful of how it affects you. Many women need a bit higher dose before their periods because of hormonal changes. Another very common question is, how long should I stay on ADHD medications? Forever? Well, the need to taking medications, the doses of medications may change over time. Depends on many factors. There is no evidence that long-term stimulant use is harmful so far when taken as prescribed. However, not treating ADHD can have serious consequences, including higher risk of self-medicating with nicotine or cannabis and alcohol, etc., binge eating and obesity, poor lifestyle choices leading to long-term serious health issues, increased anxiety, depression, and poor social relationships, and maybe dementia, lower life expectancy due to unmanaged symptoms. I have older patients who are now retired, but because of untreated ADHD, they keep drinking alcohol or use cannabis, putting their body and brain in more harms. In such cases, it's better to keep taking medications. Many people find that once their ADHD is treated, they feel more motivated to exercise and eat well and have better self-regulation, reducing impulsive behaviors, and they no longer need substances to manage their stress or their sleep. For more information, you can watch my video I previously recorded, Consequences of Not Treating ADHD. Of course, medication alone is not the full solution, as I said before. For long-term success, you need to learn coping skills and problem-solving strategies. You need to build a sustainable, structured lifestyle. And you need to rewire your brain to see life situations differently and respond to them differently. There are few more points about ADHD treatment with medications that I will discuss in another video. Thank you for listening.